This is a presentation around the role of the gastrointestinal tract in chronic mold toxicity. And really a conversation around what is the role of the gastrointestinal tract in what we call chronic mold toxicity and the related immune activation. There is a possibility, we don't know, there is a possibility that what we call chronic mold toxicity, what we call mast cell activation, what we call CIRS, chronic immune response syndrome, are all related to the gastrointestinal tract and all of the related processes that are taking place within the microbiome, the fungal makeup of the microbiome, and the gut immune system itself. The reason why I created this presentation was simple, because I wanted to understand what was happening to my patients. I had two types of patients. Those that get better on their own with very little effort on my part. We address the scary, ceiling is about to collapse type of mold exposure. We give them some binders, we give them a few things, and then 6 to 9 months later, they're better. And then there are those children and many adults who stay sick. You remediate the environment, but their immune systems are still reactive. And they're still toxic, and they're still irritable, and they're still tired, and their guts are still a mess, and everything is still stuck. This presentation is a detailed discussion of why these individuals are stuck and why the gastrointestinal tract may be the fundamental piece of their healing journey. And we will talk about the processes that are there that ultimately create that. So what we will talk about is ultimately an overview of mold toxicity, a basic understanding of the gut and the various pieces of the gut, how mycotoxins and molds disrupt these pieces, and once that disruption takes place, how that creates a vicious cycle of inflammation and disruption that has no end. And if I was to summarize this presentation into one slide, this is the slide that summarizes everything that we're going to talk about over the next period of time. So mold toxins may not be what create and perpetuate the disease. They are the trigger that ultimately set off the cascade of events that then lead to a perpetual state of disease and toxicity. The microbiome, the fungus in the gut, the endotoxins, which very few people talk about, the parasites, ultimately everything starts feeding forward. And once that happens, it is really difficult to stop this process unless you understand how all of these variables are impacting things. And that is what this conversation is about. And it's not to say that mold and mold toxins are the only thing that set up the stage for dysfunction. That would be very limited, premature. There are a host of environmental toxins, glyphosates, phthalates, other plastics, heavy metals, on and on and on, that we are all exposed to. And depending on how clean a lifestyle you live, you can reduce these exposures, but never eliminate them entirely. Even those who are eating organic diets are still exposed to glyphosates. Even if you do your best to avoid plastics, you're still getting exposed to them through the foods we eat and ultimately how they get into the environment. And all of these compounds are essentially what load the gun. And in that case, the mycotoxins become what ultimately pull the trigger and cause this cascade of events to take place. So if we were to put mycotoxins, molds, plus environmental toxins, that would really be a more descriptive way of explaining this cycle. I need to give credit to my friend Elroy Vojdani. He and I have been talking about this, and some of the concepts that are a part of this presentation actually originated from him. So let's start with just what is the current understanding of mold. So we say that mold toxicity is related to an acute and chronic systemic inflammatory response that essentially follows once people are exposed to a host of compounds. So fungi, bacteria, and I say compounds because there's endotoxins, there are beta-glucans, on and on and on. So there's one camp that says, you know what, this is an inflammatory, odd inflammatory response, and you can use certain chemicals and compounds to change this inflammatory response to calm it down. And then there's the other camp of toxicity, which is mold-related illness is ultimately due to toxicity. And at a certain point, the body loses its ability to detoxify because of the kidneys and liver and the gastrointestinal tract and on and on. And that loss of ability to detoxify is ultimately what creates the problems. And the mold toxins, because they're perpetually circulating in the system, plus or minus colonization, is what relates to illness. Now, what we see in both of these conversations is little discussion. I'm not saying no discussion, because there is discussion around the gut, but the gut is not the centerpiece of this discussion. And the whole purpose of this presentation is to suggest that perhaps the gut needs to become the centerpiece of discussion around what we call mold toxicity. Hippocrates said it best: all disease begins in the gut. And what if mold toxicity begins in the gut? And what is the gut? What is this thing that we call the gut? Well, the gut is essentially a tennis court-sized organ. If you were to take the gut and take all the microvilli and all the surface and just spread it out, you get it the size of a tennis court. And in that size of a tennis court is 70% of our immune system. So you can already appreciate, like, oh my God, if 70% of our immune system is sitting next to the size of a tennis court, if anything happens to the integrity of this tennis court, something is going to irritate the immune system. Logical. And what gets more concerning, if you want to say, is that the gut lining, so the lining that protects the outside of that tennis court from the inside of the tennis court, aka where 70% of our immune system is sitting, is essentially a single cell layer that is protecting us. And it's not to say it's just a single cell layer. There are multiple, as they say, multiple defense mechanisms at play. So you've got the beneficial bacteria that actually protect us. They create that first layer of protection through producing all kinds of beneficial compounds like short-chain fatty acids, or producing other, they call them defensins, and actual compounds that keep opportunistic fungi and bacteria in check, like Clostridium, Candida. The microbiota actually keep all of these other bad actors in check through the different compounds that they're releasing. You've got the IgA response, so there's the immune globulin response that's protecting us. And then beyond this mucus layer and the mucus itself, you've got the cells and the tight junctions, which are keeping things glued together. So there's a tight, it's like a tight fence that is hard to penetrate as long as that fence has integrity. And then there's the immune system sitting behind that fence, protecting us further. And we're going to talk about what happens when all of these different protective mechanisms break down because of mold toxicity. And what happens when all of these mechanisms break down, what kind of physiological processes start, and how do these physiological processes feed forward in of themselves to create a chronic, perpetual state of dysfunction? So let's start with the microbiome. All of you have heard this. There are more bacteria in our gut than there are us. They outnumber us tenfold, and they've got 100 times more genes, and they ultimately do a lot of things similar to what the liver does. So they really have a profound influence on human physiology. And this is not a conversation about the microbiome, other than to say it's really important. And I think this study says it perfectly. The mammalian immune system, which appears to control the microbes, is in fact controlled by the microbes themselves. So it's really painting this picture of how important a role these bacteria have on our immune system. And when there is a disruption, So deviation from the normal development of the microbiota, such as C-section, formula, use of antibiotics in infancy, may alter the outcome of this immune development and potentially predispose the individual to various inflammatory diseases later in life. This is how important these bacteria are to our immune system. This is how important a role they play in influencing the immune system. And when these bacteria are disrupted, and we're going to talk about how mycotoxins do a fantastic job disrupting the microbiota. And we're going to talk about what happens when you have a baby that is born into a world of mold. So these mycotoxins that have all kinds of disruptive properties are exposed to that infant from early on, from the moment they are born, and ultimately how that influences this very physiological, important piece, ultimately driving inflammation, immune dysfunction, and a host of other issues. And what we call autism, what we call PANS and PANDAS, what we call various kinds of autoimmune diseases, allergies, gut issues may ultimately be tied to this. Now, it's important to highlight that the microbiota, the microbiome, are very, very sophisticated and complex. They are literally communities. If you were to imagine little villages of people who talk to each other, who help each other out, who coordinate and function as one cohesive unit, that is really what the microbiome is. And when you read the work and listen to the work of brilliant people like Dr. Emmeron Meyer out of UCLA, what they talk about is it is silly to pay attention to individual microbes, and it is far more important to pay attention to the communities of microbes that are there. And why I'm bringing this up is I find way too often well-intending people, doing a stool study and saying, oh, your blah, blah, blah is off, and I'm going to use this bacteria to fix that one thing. And they miss the bigger picture of the community. And this, if there's one thing to say from all of this, is that these cells are communicating to one another. They're responding to their environment, and they're highly intelligent in their responses. And ultimately, through these responses, they activate pathogenic factors, such as Clostridia, perfect example. Everyone has some amount of Clostridia. You can try to get rid of Clostridia. It's really difficult. Now, there's Clostridia that's not causing a problem, and there's Clostridia that's acting in a highly virulent fashion, causing all kinds of awful things to happen in the gastrointestinal tract. Quorum sensing, and ultimately the environment that Clostridia is in, influences what that Clostridia does. And it's not just Clostridia. It turns out that fungi, like Candida, behave in the same way. All of these microbes are sensing their environment. And a way to look at it is you've got a village, and one village has 99% really outstanding, good, kind-hearted individuals. They're good people. They just want to do good. They have love in their hearts, and they're just nice. And then you've got 1% of the bad actors. Imagine the worst of the worst people. All they want to do is rob and destroy, and they would own guns and shoot them onto other people and try to kill other people if they could. Except because they're the vast minority and all of these other kind, loving people are around them, they're like, you know what, son? You look a little angry right now. Why don't you come and just have some coffee with me and let's talk about it? And when 99% of the population interacts with that 1% in that way, guess what? That 1% doesn't act up. Now, let's say something happens where that 99% is knocked down to 80%, 70%. And now 1% is now 20%. And now that 1% turns into the 20% that becomes aggressive, and they become vicious, and they become destructive, and they destroy. That is exactly what happens within the microbiome when the microbiome community is disrupted. And that is what all of this is trying to tell us. And what's really remarkable is that the microbes are, in fact, listening to what is happening in their environment. And when some kind of stressor shows up, cognitive stressor, and this is why mindfulness practices and meditation and exercises to calm the nervous system are so important in healing chronic diseases, because when you don't, that chronic stress response actually causes perturbation and changes in the composition of the microbiota. And what's really amazing is to realize how many of these bacteria and fungi actually have receptors to sense what is happening in their environment. And it's, if you think about it, it's ingenious. They sit there idle, not doing anything when everything is in good form, because they know if they do, like, they're not going to get anywhere. There's no point in wasting that energy. The moment they start sensing catecholamine stress hormones like norepinephrine, which means you are in a state of stress, all of a sudden they realize, oh, this is my opportunity to really do something. It's like the bank that has been compromised and the alarm system is shut off and the doors are wide open and the guards are asleep. And now the robbers is like, oh, this is the perfect opportunity for me to come in and rob. This is exactly what these microbes are doing. They're sensing their environment and behaving and adapting accordingly. And when that happens, when you've got psychological stress, the gut permeability is disrupted, you get inflammation, the bacteria start translocating, which means they start entering past that protective layer, and you get immune disruption within the mast cells. And we're going to talk about this in much more detail, but it's just to highlight how important mindfulness practices are in healing and how much they could be disruptive of the gastrointestinal tract. Now, what about the mycotoxins? How do they ultimately impact things? Well, the first thing to start with is that we don't entirely know. We don't entirely know because there are no studies that have looked at environmental exposure. So I have mold in my house, and what happens to the gastrointestinal tract. What we do know is what happens, especially in animals, when they are exposed to mycotoxins in their foods. What we also know is that mycotoxins can enter the bloodstream through environmental exposure, and that bloodstream exposure can hit the gut and trigger inflammation and trigger permeability, which is leaky gut. And that can cause a cascade of events, which then changes the microbiome. We also know that mycotoxins are secreted through the bile, which means that even though you're inhaling it, ultimately that can enter the gastrointestinal tract and affect the bacteria that are in the gut. We know that mycotoxins have antibiotic properties. And I mean, if you think about it in a super, super simplistic way, where did penicillin come from? Where did most of our antibiotics come from? Amoxicillin? Where did that come from? Amoxicillin came from penicillin, which is actually from penicillium. And while there are many, many different types of penicillium, and not all of them are environmentally toxic, it highlights the profound antimicrobial effects of these different mycotoxins. In rat studies, ochratoxin, OTA, ultimately reduced the diversity of the microbiota. Ochratoxin permanently eliminated Lactobacillus reuteri. And for those of you that are into probiotics, you know how important that bacteria probiotic is. This is another study that it's not just the antimicrobial effects of these mycotoxins, because they change the environment, in which the bacteria grow. Mycotoxins can have antimicrobial effects because of that effect. In the chyme, which is kind of the milieu, if you want to say, that these bacteria grow in, is also altered. And when the chyme is altered and that milieu is altered, so imagine you've got a garden. There's one garden where there's plenty of fertilizer and the plants are thriving and they're blooming and everything is amazing. And then you've got another environment where There's no fertilizer. The soil is nutrient poor. It's not getting a whole lot of water, and all the plants, bacteria, wither and die and ultimately fall apart. Mycotoxins can ultimately alter all of these different environments, which then ultimately influences how these different organisms behave. And these studies are not for us to go through in detail, but if any of you are really, really interested, pause this video for a second and look at this. These are all different types of mycotoxins that are found in animal feed and the various studies that have been found to show all of the alterations that take place in the microbiota as a result of this. And I'm just including this just to really highlight how profound of a role these compounds play in the microbiota and in the microbiome. And what gets complicated is when the microbiota, the bacteria, are healthy, they appear to help detoxify these compounds. Now, most of these studies are in ruminants, cows, and other animals that basically have bacteria in multiple parts of their intestines. And at least in those animals, it has been found that these bacteria are helpful. Now, we humans have most of our bacteria in the colon, and it seems that the mycotoxins absorb into the small bowel. So how related is this? We don't know. What we do know is that when there are distortions, you can have mycotoxins that weren't a problem that have now suddenly become unmasked and now creating an issue. And ultimately, absorption and bioavailability of these mycotoxins could be affected. So you can see there's already a vicious loop that's developing. Mycotoxins distort the microbiome. Microbiome gets distorted. That can be impacting how mycotoxins are ultimately detoxified through the system. But it's not just that. Mycotoxins ultimately change how these bacteria produce certain things like these short-chain fatty acids. And they significantly, it's not just a tiny bit, they significantly reduce these short-chain fatty acids. Now, you may be saying, well, why is that important? Well, it turns out that short-chain fatty acids are essential right there in the bottom, essential for gut integrity because they regulate the pH, the mucus production, and ultimately provide fuel for the epithelial cells to basically function and heal. So imagine a scenario where there's a compound that causes the significant reduction of these short-chain fatty acids. And as a result of that, using a very simplistic concept, all of a sudden your gut immune or gut lining cells, these enterocytes, are starving. And they don't get the fuel they need to ultimately repair themselves and replenish and nourish and ultimately function. So you've now added one more piece to this where the enterocytes, the back gut lining cells, are being starved, which then reduces their ability to repair and heal. What else happens when the gut bacteria are disrupted? Well, like I mentioned, the gut bacteria play a really important role in controlling the undesirable actors. In this case, they limit the colonization in the intestines of things like Candida albicans. And as they say over here, there's an arsenal of molecules capable of disrupting their growth. So when the microbiota are healthy, Candida, even though it's present, every single one of us have Candida. When the microbiota are healthy, Candida is that 1% where, the good people are sitting down saying, son, why don't we have some coffee and talk? Let's see what's bothering you today. And Candida doesn't act out. It doesn't become invasive. It doesn't cause an issue. Now, what happens when that changes? Candida, the predominant gut fungus, has the ability to invade tissues and disseminate in the body when the gut microbiome is disrupted. It is well adapted for growth in the gastrointestinal tract where inflammation may perturb, another study, these are two different studies, may perturb the resident bacterial community, creating a condition that is favoring Candida colonization and inflammation. And then if you add to that, it's not just a microbiome, intestinal mucosal permeability, and a disruption in the immune system. So when everything gets distorted, Candida has a field day. And it's like, There's no one keeping it in check. And if anything, Candida starts replicating, starts going aggressive, and starts causing all kinds of problems. And what's really crazy is when Candida is now in that shape of aggression, Candida prevents lactobacillus from regrowing. So disruption causes Candida to overgrow, which then causes further disruption in the microbiome, and you have entered another vicious cycle. And you'll see this presentation is all about these vicious cycles that start, and once they start, they really don't stop until you understand how to intervene. And this is really what we get. Mold toxins, bacterial dysbiosis, fungal dysbiosis, worsening bacterial dysbiosis, a bigger problem. Now, what happens when the gut health is compromised as a whole? So what these authors talk about is what takes place when the gut integrity is now compromised. So we've talked about the microbiome, and the microbiome gets disrupted. Candida and all kinds of unpleasant actors are now acting up. But what happens when that protective layer, the mucin, the immune system, the tight junctions, that are keeping the fence tight, what happens when all of those pieces are compromised? So when that has happened, and the bad actors have now breached the fence, you get activation of the immune cells. And the immune system comes to clean up the foreign agent. And if for those of you that want to read the details right there, pause the video and read this. But ultimately, the immune system says, you know what, we've got bad actors, and now we're going to roll in the army to control these bad actors. And why? If these bad actors get into the bloodstream, guess what? We die. That's called sepsis. Sepsis is basically when bacteria have gotten into the bloodstream, and now they've taken over and they have killed us. So you can imagine why we need 70% of our immune system sitting at the gut level, because these bacteria, while they're great inside the gut, they are a disaster outside of the gut in the bloodstream. And when this inflammatory response happens, it contributes to a leaky barrier when excessive. It disrupts the epithelial barrier by downregulating the tight junctions and ultimately compromising the physical barrier. So the way to look at this is you've got the bacterial disruption, which causes problems because the bacteria control the immune system. And then if anything else, any kind of stressor now disrupts that fence lining, that protective lining, once that happens, the immune system comes and starts basically nuking that area, which then further disrupts the gut integrity, which then, if you can imagine, starts creating this vicious cycle of bacteria coming in, immune system attacking it, and on and on and on and on. And you essentially get this very thing. It's not just that inflammation disrupts the gut protective barrier. It turns out that inflammation-induced barrier damage often disrupts the symbiotic relationships between the commensals. And because it changes the environment that these bacteria are in, that ultimately further impacts the beneficial bacteria's ability to survive and grow, which ultimately results in a deviation, sometimes a permanent deviation in the makeup of the microbiota in the gut that are there to help us. And because you now get that inflammation-mediated dysbiosis, that then further compromises the gut barrier, which then further causes an issue. So as you stand back and you see these pieces coming together, and this is why I created this presentation, because as I was putting this information together, all of a sudden I'm like, oh my God, this is what's happening. And this is exactly what Dr. Elroy Vojnani is seeing in his practice. And credit where it's due, a lot of these things were ideas that we have bounced back, and a lot of these things he encouraged the development of. And once this barrier is compromised, you get this pro-inflammatory microenvironment, and the damaged barrier perpetuates the constant immune activation and due to the exposure of microbial signals. So essentially, you get to a point of no return. The gut barrier is so compromised and everything is so activated. And there are so many things interacting with the immune system that all the immune system can do is just fight and fight and fight, which further damages the gut, which then further perpetuates the inflammation. And this is the very thing that I believe is at the root cause of what we call mold toxicity. It's at the root cause of what we call mast cell activation. It's at the root cause of what we call CIRS. And I'm going to talk about all of the different things that now come together to create the rest of that picture. Before we do that, there's an interesting question to ask. Does this happen to everyone? And the answer is no, it doesn't. And in fact, there are only a small percentage of the population, about 1/4 of people, that are impacted by mold toxicity. And I'm not saying that 1/4 are impacted by this, but I want you to follow me for a second to see how all of this is coming together. For those of you that have been following the world of mold long enough, you have heard of the name Richie Shoemaker. Dr. Shoemaker was one of the original people who raised the flag, sounded the alarm around mold-related illness. And he was one of the first people to look at the HLA subtypes that contribute to the vulnerability of mold toxicity. And, for the longest time, I was scratching my head. I'm like, how does the immune system tie into toxicity? Now, remember, there's the Dr. Shoemaker camp that says all of this is an immune imbalance and hormones and other things. And they actually do not believe in toxicity being a part of this picture. But what we're going to talk about is how actually this model of the gut explains how all of these things come together to cause issues. So it turns out that when you have these susceptible types, and you ask the question of, well, how do these susceptible types impact the gut and microbiome? You come across a lot of fascinating studies. I'm just citing one of them. That it turns out that these HLA subtypes determines the immune response first and foremost, and the efficacy of that immune response, but also what that immune response does against the commensals present in the gut. And what they have found is a statistical association between what kind of HLA haplotype you have and what kind of bacteria you have in your gut. So what is entirely possible is the reason why these HLA subtypes, it's not the whole picture by any means. This is way more complicated than just this focus piece. I realize that. But you can't deny the question or the possibility that these immune susceptibilities may ultimately be causing mold-related illness because of the impact they have on the gut, immunologically and microbially. And now, if you ask another question, which is, how does this fit into the picture of autism? It turns out that depending on the certain HLA subtypes, you can have a relative risk of 19.8, which is essentially a 20-fold increase in the risk of autism based on certain HLA subtypes. Now, these authors are very quick to highlight that it's not as simple as, oh, you've got one or two of these, and therefore you've got a 20-fold increased risk. It's way more complicated than that. But what it does suggest is that these children who ultimately get diagnosed with autism, and one of the things that I see in my practice is what we call regressive autism. Those children that are doing fine, they're making eye contact, they're talking to you, they're developing speech. And then there's that tipping point where suddenly everything falls apart. Or the children with PANS and PANDAS, they're doing fine, they're doing fine, they're doing fine. It wasn't a strep infection, but something else suddenly just tipped them over and they are now stuck. These are the kids that I have kept questioning. And literally the whole reason why I've created this presentation is to understand why these kids suffer the way they do. And it is entirely possible is that genetically, they are vulnerable at the gastrointestinal level, at the immunological level within the gastrointestinal tract. And because of that, they're vulnerable within the microbiome that's ultimately impacted by these factors. And that creates a scenario where these children are then set up to be hit by mycotoxins and fall apart. And what I do find is many children who are ultimately diagnosed with regressive autism, what they do have as the thing that tipped them over was ultimately exposure to these mold toxins. And 1/4 of homes, depending on the region you live in, do have mold. 1/2 of all homes that have been flooded have mold. So you can appreciate how much exposure is taking place, and we have little awareness around this. So now, given this vulnerability, how did these mycotoxins ultimately damage the gut? Like, what happens? So previously in other presentations, I've highlighted some key factors for us to understand, which is when you get water penetration, we inhale those compounds, and I'm reiterating this. We inhale those compounds, they go into the bloodstream, and once they're in the bloodstream, they can actually impact the gut. And what we do find is that mycotoxins can cause significant damage to the intestinal permeability, the fence that keeps the outside of the gut from getting into the inside of our bodies. They damage the intestinal cells and microvilli, and ultimately they cause white blood cells to infiltrate. And if you were to highlight all of the damage that mycotoxins can cause, all of these red arrows are highlighting that. And that is on top of changes to the microbiota, which we already talked about. And this sentence right in the bottom is, I believe, really important. DON, which is a type of mycotoxin, causes disintegration of the human cacao, which are basically these epithelial cells, within a few hours of exposure with tiny, tiny, tiny amounts of exposure. And for those of you that are saying, well, God, like, okay, how does this relate to the bloodstream and inhalation and exposure? So maybe it's fine and dandy if all of this is in food, but what about, if you're living in it? So again, I highlighted that there are studies, some very well done studies that have demonstrated that when you have water damage, mold toxins are released, we inhale those, it goes into the bloodstream. All of that has been documented. When it is in the bloodstream, the effect of DON, again, the mycotoxin applied to the basolateral side, this is the basolateral side, the systemic blood flow side, going into the cell, is actually worse than if it was on this other side. Why? Because you had this protective layer of bacteria, depending on where it is, in the mucus lining and the immune system and the small bowels protecting us. In this case, there's nothing protecting the backside of these epithelial cells. So when the mycotoxins come in from the bloodstream, go and hit the gut, that actually causes worse damage. And by causing intestinal permeability, mycotoxins allow the entry of various proteins, including foods. So you now have the gate is broken. And now because the gate is broken, what's inside the gut? Well, there are bacteria and there are foods. And now these food proteins that shouldn't be hitting the immune system are hitting the immune system, causing the immune system to become active. The immune system becomes active, starts attacking the cell lining, causing further damage. You've got one cycle now developing around dysfunction. And as a pediatrician, this study is part of what causes me to worry at nights. So considering their parent lactational transfer of mycotoxins, which mycotoxins do transfer in the breast milk, these authors say that infants deserve special attention. Because if there are even minor changes, and they're specifically talking about mycotoxins, if there are even minor changes to the barrier function of these little babies, that sets them up for allergies down the road. And again, Think about the babies that are born into mold toxic environments, and they're exposed to mold toxins from day one. It's in mom's breast milk. They were exposed in utero. Constant barrage of mycotoxins disrupting the microbiome that's barely forming in these little kids, disrupting the gut integrity that is trying to normalize itself. And at a certain point, what seems to happen, and for each child it's different, at a certain point, it seems that there's a breaking point. And once they enter into that breaking point, they enter this vicious cycle that you saw in the beginning of this presentation that just keeps perpetuating itself. As you see, once foods come in, they activate the immune system, which then causes further issues. Now, I wish it was just as simple as, oh, they just disrupt the gut integrity and they disrupt that fence and they cause leaky gut, which then causes foods to come in. It's not. They actually change the immune response within the gut itself. They suppress the very immune system. All of these IgAs, all of these proteins that you see that were there to protect us, they actually disrupt the immune system that is there to protect us, and thereby create another layer of vulnerability that then allows the gut to become compromised. And, one of my dear friends, Jill Krista, says it beautifully. Molds are there to decompose things, right? They literally are. You have a compost post. What's composting things? Mold. It's really, 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 really bad when you, as a living human being, or your child, are now being composted or decomposed because of these mycotoxins. And when you look at what these mycotoxins are doing, it makes sense. Yeah, you want to disable the immune system. You want to break down these gut barriers. You want to disable the very things that are keeping us healthy and alive. Why? Because they're there to decompose. And when you turn it into that model, all of a sudden, all of these studies and data makes absolute sense. What about the mucus layer? Turns out that another thing that these mycotoxins are fantastic at doing is causing these gobulate cells to decrease, which ultimately influences the mucus layer that is there to protect us. And if you were to summarize what these mycotoxins do, they literally hit the gut immune protective mechanisms at every layer. They disable these protective immunoglobulins. They disrupt the microbiota. They disrupt the mucus layer. They disrupt the tight junctions. They disrupt the immune system that's there. And they just open the gate for anything that's in the gut to now enter into the system. What happens when all of that happens? The bacteria now start entering into the gut. So you've got the food antigens coming in, the barriers are disrupted, the bacteria now enter in, which then causes, in this study in particular, they're talking about the persistence of inflammatory bowel disease. And mechanistically, it actually could be that this entire process that we're talking about is one contributor to inflammatory bowel disease in some patients. I'm not an IBD patient. I've only treated a handful of kids, but I have seen molds contribute to that. But take this inflammatory bowel disease out and ask yourself a key piece of the induction and persistence of mold-related disease. And I would say yes. When all of this happens, you can get the onset and persistent of mold-related illness. And you get another perpetual cycle of inflammation and dysfunction that just has no end. And what happens when the gut catches on fire? What happens when the gut is completely disrupted? That then creates a scenario for the bacteria. So this is all a summary of before. It creates a scenario for the bacteria to start interacting with the systemic immune system. And this is the next layer of this conversation. When that happens, There's an increase in blood lipopolysaccharides in the absence of infection, leading to chronic inflammation. And it turns out that there are other things like these sphingolipids, which are essentially these glycoproteins that enter into the bloodstream, and they can trigger a whole cascade of events. And we're not going to talk about sphingolipids because that's another hour-long conversation in of itself. But it's to say all kinds of awful things happen. And these lipopolysaccharides are called endotoxins. And what I would like to propose is the possibility that what we call mold toxicity and the concern we have around the mycotoxins causing perpetual toxicity, perpetual problems, that it is not just the mycotoxins. It's not to say the mycotoxins don't play a role. They do play a role. They do cause problems, as you're seeing. It is to say that the mycotoxins alone are not the reason why there is all of the issues that are related to what we call mold toxicity. And if I were to summarize mycotoxins, I would say the mycotoxins are the ugly cousin of endotoxins, or endotoxins are the ugly cousin of mycotoxins. They're both awful. They both cause a host of different issues, including disrupting the permeability of the gut, activating the immune system, activating systemic inflammation, activating the microglia. We're going to touch on that. They disrupt the blood-brain barrier. They disrupt neuronal function. They disrupt the mitochondria, on and on. And what's interesting, as I'll touch on a little bit later, is the same binders that we use to detoxify mycotoxins. It turns out that all of these binders listed on the bottom are fantastic at binding endotoxins. And it is possible that part, if not a large part, of the benefit that we see from these binders is actually in reducing these endotoxins to reduce that cycle of inflammation to allow the gut to heal. And this is what we're going to talk about now. So what are these lipopolysaccharides? So bacteria have these little antennae, if you want to say, these glycolipids. And it turns out that the immune system has a way of finding these antennae and identifying them. Obviously, it makes sense because if you're the immune system, you want to know if the bacteria are causing a mess, right? You want to identify those antennae and say, oh, there's that bad bacteria. I need to be paying attention to you. When there is gut dysbiosis, disruption of intestinal barrier function, that is a major determinant of low-grade, and I would add chronic endotoxemia, because of the translocation of these glycolipids into the systemic circulation. And this is to also add that the bacterial makeup, the microbiome, is also a determining factor of this. Now, why is this important, right? Why is this a big deal? So the first thing is, on top of everything we've talked about in terms of what activates the immune system, it turns out that obviously the immune system doesn't want bacteria in the body, right? The immune system wants to keep these bacteria out because they will kill us. So it turns out that the immune system has these toll-like receptors that recognize these lipopolysaccharides. And when these lipopolysaccharides show up, you get immune activation. I mean, it's kind of common sense when you think about it. When you get immune activation, it triggers inflammation, which then further disrupts the tight junction proteins, the glue that keeps that fence together, which then further allows the translocation of these bacteria into the systemic circulation. Things catch on fire. That fire causes a larger fire because now the immune system is adding to that fire, and you get a vicious cycle that has no end. And this is just a diagrammatic summary of the immune activation that takes place. So what it now is added is these bacterial endotoxins that are further perpetuating things. And now, unless we're able to address this element of the dysfunction, this cycle just keeps turning and turning and turning and turning for years, in some cases for decades. why are these lipopolysaccharides important outside of the fact that they activate the systemic immune response? So we have these things called the microglia in our brain. The microglia are the immune systems within the nervous system, within our brain. And it turns out that when the microglia are activated, they do all kinds of unusual things to the nervous system. They can trigger a fear response. So in another presentation, I've talked about how microglial activation can trigger changes, actual wiring, physiological changes in the amygdala, which is our primitive brain. And that activation can distort the fear response. There are studies out there, and you're welcome to go look at this, studies out there that tie microglial activation to PTSD, to depression, to anxiety. So all kinds of unusual cognitive, behavioral, learning manifestations come through this activation of the microglia. Turns out that doses, and these are big doses, 1 milligram per kilo in these poor rodents, ultimately caused neurodegeneration and ultimately caused disruption of the blood-brain barrier. Now, you may say, well, first of all, these are rodents. And second of all, like they slammed them with gallons of these endotoxins. What does that have to do with us humans? So it turns out that you don't need a whole lot of endotoxin to cause issues. So most people are walking around with some amount of endotoxins. And as you can see over here in these studies, when you inject these endotoxins in, the equivalent of 15 picograms per milliliter, which is not too far outside of this, you can get microglial activation and sickness behavior. I want you to look out in our society and look at how many people present in a depressed, exhausted, brain fog, and kids and adults present in this way of just, right? They're just, they can't think clearly. They're struggling. They have brain fog. They're tired. They're depressed. And ask yourself, how does this fit into the picture of what we're seeing? And we're going to touch on that. So it turns out in human beings, so animals aside now, it doesn't take a whole lot of these endotoxins to trigger all kinds of odd things. Increased systemic inflammatory response, increased sickness behavior, fatigue, headaches, muscle pain, shivering, loss of energy, loss of focus, loss of social interest, and a robust microglial activation, which then causes all kinds of other unusual things. And thus, a relatively mild dose of blood endotoxins, such as those found in people with Alzheimer's, is enough to trigger this inflammatory response. These are the things that we're not even talking about. It's not even on the radar of most people. We're not even looking at how this is impacting autism, PANS and PANDAS, learning disability, anxiety, on and on and on. It's there in the literature. There are people like these authors that have looked at this. And as you can see, the study is only 3 or 4 years old. How long will it take for us to take this information and to put it into clinical practice, to ultimately use this information to help people? Because as you'll see in a little bit, there's so much we can do to help if we just get to a point of talking about this. And I want to reiterate this because I think it's important. Lipopoly LPS treated individuals, so these are human beings that got injected. I don't know why you would volunteer to get bacterial toxins injected into you, but I guess there were people that somehow wanted to do that. But lipopolysaccharide treated individuals felt tired, sleepy, had reduced appetite, engaged less in social interactions, had changes in motivation, alterations in cognitive processing, alterations of cognitive processing of negative information, those people that are just looking at the world always in a depressed, negative fashion, distortions of social stimuli, feelings of social disconnection, changes in the fear response. This is real. These findings are not esoteric. These clinical manifestations are not abstract. If you open your eyes and you start looking around, this is happening to a significant part of our population, and sadly, a significant part of the pediatric population. And if I was to summarize why I'm doing this, it is because I look around and I see this happening to so many kids, and we are not even looking at it. Ask the question, how is this related to autism? Compared to healthy subjects, levels of endotoxins are significantly higher in those with autism. And if you don't believe that single study, there's another study right there that then goes on to say that this may also lead to the neurodegeneration that we see in these poor kids and all of the awful things that they have to struggle with. If that wasn't enough, because these lipopolysaccharides ultimately damage the brain cells and they ultimately release these phosphatidylserines, so it's like the fats that are a part of these brain cells, the immune system, the microglia now are like, what the hell is this protein? I don't recognize it because it shouldn't be sticking out there. Boom, they start attacking the neurons, damaging the neurons. Microglial phagocytosis. You know what phagocytosis is eating up, destroying of the neurons. A single prenatal little baby exposure of lipopolysaccharides. And what you'll see is there are studies that talk about if mom has immune activation, if mom has some kind of odd chronic infection, the risk of autism goes up 200 to 300%. A single prenatal exposure to lipopolysaccharides can result in long-term activation of brain microglia lasting into adulthood, being reminiscent of what we call autism. And perinatal infections are also associated with autism due to this very thing. This is real. This is happening underneath our noses, and we're paying almost no attention to it. And it's not just the microglia. It's not just the T cells. It turns out that the other thing that these lipopolysaccharides can do is ultimately activate mast cells. And when the mast cells get activated, they create a whole host of other problems, which we're going to talk about in a little bit. And I don't want to pretend that I've covered everything that there is. That would be absolutely ridiculous. And it's not to say that what I'm presenting to you is 100% complete, because chances are in 6 to 9 months from now, I'll learn something new that will further enhance my understanding of this. And I'm including this study because I just want to highlight how complicated this entire conversation is and how many different things take place within the gut and the immune system and the systemic functioning of us when this barrier is disrupted. I wish that this was something that was just taking place in the gut. It turns out that when you have water damage within a home, it's not just fungus and mold that grows. You actually get various kinds of bacteria that join the party. So it's literally like a big block party, and you're like, hey, free beers for everyone that wants to join. And all of the bad actors from the town are showing up at this block party. And guess what these bad actors, the non-fungi bad actors, are able to produce? They're able to produce endotoxins. They're releasing lipopolysaccharides into the environment of the home. And it turns out that when you get that release, that causes a dose-dependent increase of all of these inflammatory markers through inhalation. We're not talking anything fancy. Through you inhale it, it triggers an immune response. And ultimately, they're saying that it's possible that some of the wheezing and respiratory issues that we see in some individuals is actually related to the endotoxins that they're inhaling. So it's not to say that it's just the gut falls apart, the endotoxins enter the bloodstream, and that's all there is. It's to say there's a lot more happening. And these are studies looking at, first of all, what happens in the agriculture world and how many people that are in the agriculture world, if they're not careful, are exposed to these endotoxins. And also variations within different homes that have been tested to see that, you know what, this can actually be, if the home is dirty enough, you're now reaching what you see in certain agricultural environments, to highlight how significant this other piece of it is. And if that wasn't enough, when the sinuses in ear, nose, throat region is disrupted, which it can easily be disrupted from all of the environmental exposure, and we're going to expand on this in a little bit, that actually causes a disruption of the mucosal lining within the sinuses, which then causes lipopolysaccharides to then enter into the picture and cause inflammation, such as chronic rhinosinusitis. And it turns out the mast cells are also present in the sinuses, which can then cause further immune activation in a larger context. When the lipopolysaccharides are at play, they're triggering essentially every piece of the immune response that has to do with the nervous system, causing a host and just an epic mess that takes place systemically and within the nervous system. Now, here's the part that's really interesting. For the longest time, I've asked myself, like, God, some of these kids that improve with the binders that I give them, is it just the mycotoxins that I'm pulling out? Because I've had some kids where I put them on bentonite clay or cholestyramine or whatever, and the parents are like, yeah, a week later, oh my God, he was so much more focused. Oh my God, he was so much more clear-headed. Oh my God, he was learning differently. And he was able to learn things and focus better and process better, and his executive functioning improved in 2 weeks. And I had a hard time understanding, like, how could this be just the mycotoxins? Like that actually doesn't make sense. So I went looking, and it turns out that endotoxins, not just mycotoxins, endotoxins are metabolized and excreted into the bile, which is the same thing as mycotoxins. And when you're unable to do that, you can get low-grade endotoxemia. Now, it turns out that the very binders that we use to treat mold toxicity, cholestyramine, activated charcoal, bentonite clay, have all been shown in scientific studies to actually be effective, in some cases very effective, in binding these endotoxins and pulling them out before they can go into systemic circulation. And I believe at least some part, if not large part, of the benefit that we see from these binding agents is not just from the binding that they do of endotoxins. It may actually be that what they're doing is pulling these endotoxins, and then when you go and rewind, once endotoxins hit circulation, they activate the immune system. Once they pass the gut barrier, they disrupt the gut integrity, right? They disrupt the intestinal integrity. All of these things then trigger the immune system, which then further comes to attack. If you pull these endotoxins out and you absorb them from the bacteria before they're able to actually hit the gut immune response and enter into circulation and ultimately reduce the endotoxin load within the circulation of the body, which then doesn't cause them to activate the microglia, right? Because they're not going in, they're not disrupting the blood-brain barrier, they're not activating the microglia, they're not activating the astrocytes, which then further calms down that inflammatory response. Is that part of the benefit that we're seeing in using these different compounds? We don't know. I suspect that they're at least playing some part. Large part, smart part, we don't know. They're at least playing some part, and this endotoxin binding piece may be more important than we realize. So what about the other piece of this conversation, because I wish it was as simple as it was just the endotoxins, the gut that gets disrupted. That's what causes all of the issues. It's not. It turns out that fungi also play a role in the disruption of the gut. And I would postulate, I don't know for sure, I would postulate that the fungi and molds that become prevalent in the gut are one of the predominant provoking pieces of the cycle that actually keeps the cycle going. And what we see is studies that talk about how, especially in early life, when you have any changes to the fungi, they can actually influence the maturation of secondary lymphoid tissues, which is basically they can influence the immune system. And increased amounts of aspergillus, which can come from the environment, was sufficient to induce and exacerbate allergies. Now, you may be asking, well, what about Candida? How does Candida play a part in this conversation, right? You go looking, what you find is another really interesting study from 2019, not that old, where they took 300 babies that had allergies and they asked, like, well, what's different about these babies? What's going on in their gut? Specifically, what's going on within the fungal makeup of their gut? And what they found was some of the beneficial bacteria were reduced, and Candida in particular was increased. It was much more prevalent. And think about all of the things that we talked about with the mycotoxins. They disrupt the microbiome. They knock down these very strains of bacteria, and they cause Candida to now flourish. And all of this ultimately exerts an immune response outside of the intestines. Now, a lot of people, as soon as you say that, their knee-jerk reaction is molds do not colonize the gut. And I have actually gone and contacted multiple microbiome. These are researchers that all they do for their living is talk about the fungal makeup of the gut. And all they say the same thing. Molds do not colonize the gut. So you find these studies, and this is one, and this author I actually spoke to, where they actually say that the hypothesis that we have is that fungi do not regularly colonize the gut of healthy adults. And if there was one thing for me to highlight is healthy adults. Gosh, so what happens to the unhealthy adult who has been sick for a decade plus? What happens to the adult whose microbiome is completely fallen apart? And more so, what happens to the gut of the little ones? And if you go and try to find the study, and if any of you are aware of a study, I would love for you to share it with me, because I've spent some time looking, and I have yet to find one study that has looked at what environmental exposure to mold and mold toxins do to the microbiome, the fungal biome of little babies. We don't know. And my concern is, and what I see clinically in my practice, is that these kids have completely distorted micro and microbiomes. They do have higher rates of Candida. They do seem to have what seems to be colonization with aspergillus. But let's look into the literature. So the first thing that this group talks about is how certain environmental molds like cladosporium, and cladosporium happens to be highly allergenic. So it's not toxic. It doesn't produce mold toxins. It doesn't create toxicity, but it's really good at triggering a allergy inflammatory response. And what they say is like, gosh, cladosporium shows up often enough to the point where we can't rule out that it is causing a colonization issue in healthy adults. And when you look, like aspergillus also is sometimes showing up in vegetarians more so than others, even though cladosporium is more prevalent. Now, look at Candida right here, and I just want you to just watch that for a second. Many authors say, well, molds can't grow in the body because the temperature doesn't allow molds to grow. And it's absolutely true. Stachybotrys, the classic black mold, doesn't grow in the body. Chaetomium, another really awful black mold, doesn't grow in the body. Penicillium, another type of mold, doesn't grow in the body because it just does not like our high body temperature. It likes, they're more picky, they like the more temperate climates that's more like Southern California, not like Arizona, 120-degree heat. But it turns out that Aspergillus actually is fine being in 120-degree heat. And, when the body goes up to 99 degrees, Aspergillus is like, oh, I think I'll just turn on my air conditioner. It's not a big deal. Let's look at that a little bit further, because what we find is while the prevalence of Aspergillus and Aspergillus versicolor is an environmental mold is not as high as Candida, and it doesn't show up as often as some of these other ones, it's still there. It's still there, and it's still, disturbingly prevalent in some of these studies from healthy adult samples. And what we also find, so going back to the conversation around the sinuses, right? We talked about how endotoxins can originate from the sinuses. It turns out the mast cells are sitting in the sinuses. And what is commonly found, so maybe it's not so commonly found in the gut, according to the conventional literature, what is commonly found in the sinuses is Aspergillus. And what they go on to say is that a lot of times you can even get a fungal ball because of the amount of colonization that's there. So when you stand back and you really dissect parts of this conversation, all of a sudden you're like, oh, Jesus, there's so much we don't understand. There's so much we don't know. And we make so much presumptions about the little that we do know that we say, well, mold can colonize the gut, period, end of story. That's all there is, without actually appreciating the nuances and details of some of this conversation. And here's something that I would love for you to ask yourself, because this is what I've been asking myself. If we know that with Candida becomes much more likely to colonize and ultimately become invasive and ultimately become problematic when the gut protective mechanisms are disrupted. If the very same thing happens when Aspergillus is hanging out, how does that impact the ability of Aspergillus to colonize? We don't know the answer to that. I suspect, based on my clinical experience of now treating several hundred, if not 1,000 more kids who have been exposed, that this very thing is actually more likely happening in allowing Aspergillus to also show up in the sinuses or guts of these children, creating a problem. Now, that problem is the piece that we're going to talk about. So it turns out that mold toxins in molds themselves, all different kinds, can activate mast cells. And when that mast cells are activated, they release all kinds of things. Why is that important, you're asking? And this is to specifically highlight how Aspergillus can trigger mast cells. And this author goes on to actually say that activation of mast cells induced by Aspergillus may be the initiator of the whole, I added allergy sensitization process. I mean, that should be a big scary, oh my God. Because if Aspergillus does somehow get into the gastrointestinal tract, if Aspergillus is activating mast cells through the sinuses alone, oh my God, how is that ultimately impacting the entire immune response, which then goes on to cause all kinds of things? And if you looked at that little triangle picture, remember, there was the mast cells, and then there were the astrocytes and microglia sitting, and they were all interconnected. So when the mast cells are activated, they can actually activate the microglia, which then can activate all kinds of odd things within the nervous system. And if you ever do a search for microglia autism, there's study after study after study that talks about this, saying it again. This is where things get troubling. And if I was to highlight one thing that I believe is the reason why the guts of these individuals never heal, and ultimately what we call mast cell activation syndrome, what we call CIRS, what we call mold-related illness, is ultimately mediated by this in some shape or form. And my mentor, Dr. Nathan, has highlighted this. So this isn't new, but I believe this is one significant piece of it. So when mast cells are activated, they basically disrupt the gut lining. So mast cells, like the other parts of the immune system, they destroy that tight fence and allow intestinal permeability, which then causes all of the things we talked about. Turns out that once the gut has been kind of shot to hell, right? Imagine someone's got the shotgun, they're just shooting holes in that fence to the point where there is no fence. All of a sudden, the parasites that were sitting there, and a whole bunch of us have parasites and we just don't know it. And if you go and look, like Bacteroides fragilis, all of these different parasites are sitting there. Normally, for most healthy people, they're never causing a problem. Why? Because your gut is healthy and those parasites are just sitting there not doing anything. When the gut is compromised, all of a sudden the intestinal parasites that weren't an issue are an issue. And this is really important for you to consider, that it's not the parasites that are causing the problem. It's the environment that is now allowing that parasite to become a problem. And why I have an issue with those people that are just go hunting for parasites and all they do is like, treat the parasite, everything gets better. And you treat the parasite and sometimes things get better for a week or two or a month or two, and then everything just falls apart. And everyone's like, why is this happening again? It's happening again because you didn't address the thing that allowed that parasite to become a problem. Now, if you've got a hookworm, for instance, different story. That can cause all kinds of awful things, and I've seen that happen before. But conventional parasites don't become a problem until the gut is compromised. So for those of you that are listening and you're looking at your kid saying, oh my God, my kid has got a parasite thing and I can see it, ask, what the hell allowed this parasite to become a problem? Those kids that have 15 million different food sensitivities or 15,000 food allergies, where you look and you're like, great, my kid can eat 4 things because everything else they're reacting to. Gut permeability, mast cell activity causing this issue. Turns out H. pylori can also trigger mast cell activity within the stomach. So what ends up happening is all of these other things now become a problem, which then further fan the fuel of inflammation and permeability, which then further exacerbates the cycle of dysfunction. And this, not that you need to memorize this, this is just to say there's a lot of other things that can trigger mast cells on top of what I've shared. Now, what about Candida? For those of you that looked at this and your eye caught on the very top thing, where 68% of the samples had Candida, and you're like, oh God, that's a lot. It is a lot. What about Candida? What does Candida do? So just to reiterate, Candida becomes invasive, right? When the environment is right. And it turns out that Candida is fabulous. It's fabulous at ultimately triggering these mast cells to ultimately activate. Mast cells detect fungal components through their pattern recognition receptors, and ultimately they can degranulate, which means they can go and dump out all their stuff, causing all the issues. And this is another study that talks about the very same thing, that when the proper immune system is not there, when the environment is off, Candida transitions and becomes the bad actor, which then causes all kinds of things to happen. So essentially what you get is this never-ending cycle of inflammation from all of these things now adding to this. And if mold and mold toxins are what give that nudge, right? They're just like, it's like the little scrawny kid, but the scrawny kid is enough to just push that boulder. And now that boulder has started rolling, except now there's a rocket booster on that boulder. And now that rocket booster is just spinning that boulder like it's no end. this is most likely the very thing that is happening, which is ultimately behind what we call mold toxicity and related illness. And when the mast cells get activated, beating a dead horse over here, they can disrupt the intestinal permeability. They can cause bacterial translocation and further exacerbate things. And this study is a beautiful diagrammatic representation of it's not just the epithelial integrity. It's not just immune activation. It's not one or two things. They do so many other things. They cause tissue remodeling problems. They cause neurological activity, distortions of pain perception, so forth and so on. Now, you may ask, well, how does this all ultimately impact what we're calling mold toxicity? So this is where I think mast cells are playing a much bigger role in gut dysfunction than we realize. Because when you look at most of the literature, they talk about B cells and T cells, and they talk about dendritic cells, except they don't somehow mention that most of the mast cells in our body is actually sitting in the gastrointestinal tract, and they ultimately play a critical role in the epithelial function and integrity. They modulate the immune response. They ultimately influence neuroimmune interactions and ultimately play a critical role in the entire regulation of the immune system within the gut. And once that happens, these mast cells, when the gut is disrupted, I should say, we may be asking, why are these mast cells so important, right? What's the big deal about these mast cells, Katiraei? In a lot of the other presentations that I've watched, specifically around the immune system, the gut immune system, everyone keeps talking about the dendritic cells and the antigen presenting cells and the T cells and the B cells. And obviously, all of that is very important. I'm not questioning that. I started digging into the literature to ask, well, gosh, how important a role do these mast cells play in the gut? And how significant a role do these mast cells ultimately have in modulating the immune response within the gut? So I came across this study, 2019. The largest population of mast cells in the body is in the gut. And ultimately, they play a really, really important role in regulating the epithelial function and integrity of the gut. They modulate the mucosal immunity, they modulate the neuroimmune interactions, and ultimately play a key role in the functioning of the gut. And essentially, these mast cells are part of the sentinels, and they're not the only thing sensing what's happening in the gut, but they are playing a really important role. And what's then really interesting to ask is, well, gosh, if they're not a direct part, and this is a study from 2015, you see like mast cells are not really a part of this conversation. You don't really see them anywhere here, right? Even though the vast majority of mast cells are in the gut. The dendritic cells and these antigen presenting cells, which dendritic cells are a very important part of the gut immune response. So if you ask, well, how do mast cells and dendritic cells kind of act? So that's when you come across this information. There's direct contact I don't know how much more clear they can stay. Direct contact between mast cells and dendritic cells, and that contact plays an important role in modulating the immune response. And it turns out that dendritic cells can also then activate mast cells. So they're like twin sisters that love each other, who are constantly texting and talking like, "Hey, how are you doing? How are you doing? How are you doing?" Right? One twin sister gets upset, the other twin sister gets upset, and all of a sudden everything is a big mess. So there's intracellular crosstalk between these two different cell types. And when you have that, another weird thing happens. So now we've got this immune activation. And now the question is, what else happens? Not what happens. What else happens when you get this immune activation? So we've got two different types of the immune system. There's the innate immune system and the adaptive. So adaptive produces antibodies. This is what goes after all the bad actors. Mast cells, in particular, can, through dendritic cells and through direct contact with now the T cells, which are white blood cells, can tip the T cells into going into a Th2-mediated inflammatory response. And when the T cells are activated, they can then activate the mast cells further, another one of those cycles. Why is that important? Let me add to that. Mast cells can also downregulate the T regulatory cells. T regulatory cells are basically the braking system. So you've got activation of the immune system, accelerator is going down, and now you've clipped the brake line, if there is a brake line or brake wire, I guess nowadays, right? And that then basically takes whatever control of the immune system that there was off while the immune system is getting activated. So essentially you go from happy immune system with all of these different cells kind of being in balance to unhappy immune system in this Th2 response showing up. And if you look at autism, what do they say? These kids have an altered balance of immune response. Now, it turns out that when you have a loss of Th1 activity, so you've got an imbalance, Th2 over Th1. And for those of you that want to deep dive into this, there are some brilliant lectures out there diving into this. But once you get this, what happens? You lose the ability to control persistent infections. And you lose the ability to go after intracellular pathogens. In this case, they're talking about mycoplasma. But what's really fascinating is when you ask the question of what about other intracellular infections? And I'm no Lyme expert, so just take this with a grain of salt. Isn't Lyme an intracellular infection? And how does this play a part in ultimately Lyme? And there are plenty of people that say mycotoxins cause immune suppression, which may be behind chronic mold or chronic Lyme. So you can see all of the other ramifications around this. And what I really want to leave you with is what we call mold toxicity is not just mold toxicity. It's not to say mold toxicity isn't real. It's not to say it's not playing a part. It's just to say how much more there is probably behind this term, and how endotoxins and gut dysfunction and all of these other things can ultimately cause the dysfunction, the immune dysfunction, the neurological dysfunction, the gut dysfunction, the mast cell activation, the chronic immune activation that we attribute to mold toxicity. So the gut probably is playing a bigger role than we realize. And when you get all kinds of bad things happening in the gut, that creates a chronic cycle of dysfunction. The bacterial endotoxins, these lipopolysaccharides, are contributing to some extent to the total toxic load, possibly playing a large part in the toxicity that's now associated with all kinds of things, including autism. There's a very good chance that fungal dysbiosis then enters into the picture, further exacerbating the gut dysfunction. And ultimately, we get to a point of immune loss, of tolerance, and incompetence, which then allows other things within the gut to further exacerbate this cycle creating a cycle that has no end. So what I would like to propose is when it comes to treating mold toxicity, we become a lot more aggressive about addressing what's happening in the gut. We go after gut inflammation through dietary changes, addressing parasites, using various supplements to reduce gut permeability and inflammation. We work on restoring the microbiome while reducing the fungal dysbiosis, and then use the binders to address the endotoxicity and mycotoxicity that's there. But this model of let's throw some binders in a few supplements and see what happens and help the liver work better. Not to say that that's not important, not to say that that is inaccurate. It is. It helps for sure. And for some people, those that are healthy, whose guts are in a good place, it works like gangbusters and you don't need more. If you or your child is that individual who is stuck and you did the binders and you did all this stuff and it's not making the type of headway that you need to go back and ask what is happening in the gut and address that piece. And when you do, as I have seen in some of my patients, all of a sudden everything else starts falling into place. This is just one part of the discussion. The next part of this discussion is going to be really around details around how do we treat all of this. So I hope you will join me for additional discussions around this. And in the meantime, I thank you for taking the time to watch this video. And for those of you that want to contact me, if there are any providers that are watching this video and you're interested, if you click on this QR code, I have a training program that I'm launching for the second round. And we also have a portal called Wholistic Minds that is there to help support you in doing this. Because as you're going through this information, I'm sure the first thing that's going through your mind is like, oh my God, this is so complicated. How would I ever do this to help my patient? And there are some of you patients that say, my God, this is so complicated. How do I ever find a provider that can help me do this? I know we need more providers out there doing this work, and it doesn't have to be complicated. It doesn't have to be astrophysics. It is complicated, but it's not once you distill it down into a few things. And if you distill it down like, oh, okay, there's this cycle. We just need to get smart about how to address these different pieces of the component. That's where this training and mentorship is around. That's where the portal, the AI portal is around, to help providers understand all of these different pieces, to help providers understand how to do testing to assess these different pieces, and then ultimately bring forward supplements and treatments to help address it. And I hope through this and through these discussions and through the awareness, we can start changing the lives of millions and millions of people, because there are too many kids who are struggling. I mean, the reason why I spent, I don't know how many hours putting this presentation together is I just look, and there's so many kids who are struggling. There's so many adults who are struggling. There's so many kids that are just, they're giving up. They're giving up on learning. They're giving up on life because life just sucks for them. And every day is a struggle. Every day is a challenge. Every day is pain. Every day is just suffering. And kids don't deserve to. I mean, no one deserves to suffer, but little kids in particular, they don't deserve to suffer. They don't deserve to suffer. They deserve better. And we owe it to them to make things better. And the only reason why I did this presentation and did this research is I feel we need to do more to help these kids. And that's what this presentation was for. So I thank you for watching. I thank you for taking the time to really go through all of this with me. And I encourage you to reach out. I encourage you to reach out. And if for those of you that are on social, you're welcome to follow me at Instagram at Wholistic Kids, KIDS, same Wholistic. And together, let's bring these conversations forward. And together, let's bring more awareness. And together, let's change the world and bring forth health and bring forth vitality and allow people to thrive. Because that's what this is about. All of this information is there to help people thrive and to help kids thrive and to help kids and adults live healthier and better lives. So thank you. Thank you for taking the time. Thank you for being a part of my community. And please share this with others that you think would benefit. You be well. This is Dr. K.